There's so many different factors that go into what makes Penn such an amazing place. I've been at Penn for a long time. I feel very lucky to work with some of the leaders in the field. Generally, patients that are getting curative intent radiation for head and neck cancer, it's quite an ordeal in terms of the time commitment, but also the toxicity. So these patients, because of radiation dose to the lining of the back of the throat, i.e. the mucosa, they tend to have a lot of discomfort with swallowing, that they have to modify their diets, or they're eating mostly a liquid diet. So sometimes that would be opioid medications. Sometimes it's so severe that we have to stop treatment. And particularly with head and neck cancer, we know that time is of the essence, and any delay in the delivery of the course of radiation therapy can compromise the survival outcomes. So we really need to do everything we can in our power to minimize the severity of the mucositis, which is the radiation source in the throat, during the course of treatment.
When we can deliver photobiomodulation and very specific therapeutic dosages, we can reduce the severity of oral mucositis lesions by about 70%. Okay, and that's without calculating the dosage. In my specialty as a periodontist, we have multiple decades of research where we understand how tissue regenerates inside of the mouth, specifically in the areas where oral mucositis lesions are affected. Okay, taking our understanding of these wound healing cascades, of these biological disciplines, and then intermeshing it with the radiation oncology teams and the teams of medical physics, we now understand how we can better calculate these dosages of light to have a very predictable therapeutic effect.
Dosimetry means measuring the quantity of the light, either released into the tissue or absorbed by the tissue.
If we don't deliver enough light, clearly we're not going to have an effect. But with photobiomodulation light delivery, if we deliver too much light, we actually negate the efficacy of the treatment. It actually reduces the efficacy of how much light is delivered. So we really have to deliver light at the perfect threshold. Unfortunately, right now there's a one-size-fits-all model for that. So everyone just sort of delivers the same amount of light for every single type of patient, regardless of their skin color, regardless of the skin type. And they're not accounting for absorption and scattering properties.
The smart dosimetry system ensures accurate light delivery by measuring the actual amount of light that reaches the target tissue in real time. To do this, the SDS uses specifically calibrated isotropic detectors that can measure light coming from all directions.
Light delivered is the quantity that determines the outcome. And what we have developed is basically a probe that can determine the amount of light delivered under any condition. Our idea is if the dosimetry is important, we have to determine the amount of light actually delivered. And our system will directly correlate with outcome, strongly correlate with the outcome of the treatment.